Prometric Q&A and Rationals 351-400 Part 1. 351. A nurse is working with a client who has just stimulated her anger by using a condescending tone of voice. Which response by the nurse is most therapeutic? 1. I feel angry when I hear that tone of voice. 2. You make me so angry when you to me that way. 3. Are you trying to make me angry? 4. Why do you use that condescending tone of voice with me? Answer. 1. This response allows the nurse to feedback without making the client responsible for the nurse's reaction. Stating that the client makes you angry is accusatory and blocks communication. Are you trying to make me angry is a challenging remark that can lead to power struggles, lowers the client's self-esteem, and blocks opportunities for open communication. Avoid why questions such as why do you use that condescending tone of voice with me, because these questions put the client on the defensive. 352. A client on the unit tells the nurse that his wife's nagging really gets on his nerves. He asks the nurse if she'll talk with his wife about her nagging during their family session tomorrow afternoon. Which response is the most therapeutic? 1. Tell me more specifically about her complaints. 2. Can you think why she might nag you so much? 3. I'll help you think about how to bring this up yourself tomorrow. 4. Why do you want me to initiate this discussion in tomorrow's session rather than you? Answer. 3. The client needs to learn how to communicate directly with his wife about her behavior. The nurse's assistance will enable him to practice a new skill and will communicate the nurse's confidence in his ability to confront the situation directly. Asking about the wife's specific complaints or reasons for nagging inappropriately directs attention away from the client and toward his wife, who isn't present. Asking why you should initiate the discussion implies that there might be a legitimate reason for the nurse to assume responsibility for something that rightfully belongs to the client. Instead of focusing on his problems, he will waste time convincing the nurse why she should do his work. 353. A nurse is caring for a client diagnosed with conversion disorder who has developed paralysis of her legs. Diagnostic tests fail to uncover a physiologic cause. During the working phase of the nurse-client relationship, the client says to her nurse, "You think I could walk if I wanted to, don't you?" Which response by the nurse would be best? 1. Yes, if you really wanted to, you could. 2. Tell me why you're concerned about what I think. 3. Do you think you could walk if you wanted to? 4. I think you are unable to walk now, whatever the cause. Answer. 4. This response answers the question honestly and non-judgmentally and helps to preserve the client's self-esteem. Telling the client that she could walk if she really wanted to is an open and candid response, but diminishes the client's self-esteem. Asking the client why she's concerned about what you think doesn't answer the client's question and isn't helpful. Asking her if she thought she could walk if she really wanted to would increase the client's anxiety because her inability to walk is directly related to an unconscious psychological conflict that hasn't yet been resolved. 354. A 42-year-old homemaker arrives at the emergency department with uncontrollable crying and anxiety. Her husband of 17 years has recently asked her for a divorce. The client is sitting in a chair, rocking back and forth. Which is the best response for the nurse to make? 1. You must stop crying so that we can discuss your feelings about the divorce. 2. Once you find a job, you'll feel much better and more secure. 3. I can see how upset you are. Let's sit in the office so that we can talk about how you're feeling. 4. Once you have a lawyer looking out for your interests, you will feel better. Answer. 3. This response validates the client's distress and provides an opportunity for her to talk about her feelings. Because clients in crises have difficulty making decisions, the nurse must be directive as well as supportive. Telling the client to stop crying doesn't provide the client with adequate support. Telling her that she will feel better after she has a job or a lawyer doesn't acknowledge the client's distress. Moreover, clients in crises can't think beyond the immediate moment, so discussing long-range plans isn't helpful. 355. A widower is hospitalized after complaining of difficulty sleeping, extreme apprehension, shortness of breath, and a sense of impending doom. Which response by the nurse would be best? 1. You have nothing to worry about. You're in a safe place. Try to relax. 2. Has anything happened recently or in the past that may have triggered these feelings? 3. We have given you a medication that will help to decrease these feelings of anxiety. 4. Take some deep breaths and try to calm down. Answer. 2. This question provides support, reassurance, and an opportunity to gain insight into the cause of the client's anxiety. Brushing off the client's anxiety by telling him he has nothing to worry about dismisses the client's feelings and offers false reassurance. Simply administering medication or instructing him to calm down doesn't allow the client to discuss his feelings, which he must do to understand and resolve the cause of his anxiety. 356. A client is admitted to an inpatient psychiatric hospital after having been picked up by the local police while walking around the neighborhood at night without shoes in the snow. He appears confused and disoriented. Which action should take priority? 1. Assess and stabilize the client's medical needs. 2. Assess and stabilize the client's psychological needs. 3. Attempt to locate the nearest family members to get an accurate history. 4. Arrange a transfer to the nearest medical facility. Answer. 1. The possibility of frostbite must be evaluated before the other interventions. Attending to the client's psychological needs, locating family members, or arranging for transfer doesn't address the client's immediate medical needs. 357. What occurs during the working phase of the nurse-client relationship? 1. The nurse assesses the client's needs and develops a care plan. 2. The nurse and client evaluate and modify the goals of the relationship. 3. The nurse and client discuss their feelings about terminating the relationship. 4. The nurse and client explore each other's expectations of the relationship. Answer. 2. The therapeutic nurse-client relationship consists of 3 overlapping phases: the orientation, the working, and the termination. During the working phase, the nurse and the client together evaluate and refine goals established during the orientation phase. The orientation phase involves assessing the client, formulating a contract, exploring feelings, and establishing expectations about the relationship. During the termination phase, the nurse prepares the client for separation and explores feelings about the end of the relationship. 358. When preparing to conduct group therapy, an advanced practice nurse keeps in mind that the optimal number of clients in a group should be 1. 3 to 5. 2. 6 to 8. 3. 10 to 12. 4. Unlimited. Answer. 2. Clinicians generally consider 6 to 8 people to be the ideal number of clients for a therapeutic group. The size allows opportunities for maximum therapeutic exchange and participation. 359. A therapeutic nurse-client relationship begins with the nurses. 1. Sincere desire to help others. 2. Acceptance of others. 3. Self-awareness and understanding. 4. Sound knowledge of psychiatric nursing. Answer. 3. Although all of the options are desirable, knowledge of self is the basis for building a strong, therapeutic nurse-client relationship. Being aware of and understanding personal feelings and behavior is a prerequisite for understanding and helping clients. 360. A client complains of experiencing an overwhelming urge to sleep. He states that he's been falling asleep while working at his desk. He reports that these episodes occur about 5 times daily. This client is most likely experiencing which sleep disorder? 1. Breathing-related sleep disorder. 2. Narcolepsy. 3. Primary hypersomnia. 4. Circadian rhythm disorder. Answer. 2. Narcolepsy is characterized by irresistible attacks of refreshing sleep that occur 2 to 6 times per day and last for 5 to 20 minutes. The client with breathing-related sleep disorder suffers interruptions in sleep that leave the client with excess sleepiness. 361. A nurse is caring for a client who complains of fatigue, inability to concentrate, and palpitations. The client states that she has been experiencing these symptoms for the past 6 months. The nurse suspects that the client is experiencing circadian rhythm sleep disturbance related to which factor? 1. History of recent fever. 2. Shift work. 3. Hyperthyroidism. 4. Pheochromocytoma. Answer. 2. The client is experiencing circadian rhythm sleep disorder, palpitations, GI disturbances, fatigue, haggard appearance, and poor concentration, which is typically caused by shift work, jet lag, or a delayed sleep phase. Fever is a contributing factor in parasomnias. Hyperthyroidism and pheochromocytoma are causative factors for primary insomnia. 362. A client comes to the clinic complaining of the inability to sleep over the past 2 months. He states that his inability to sleep is ruining his life, because getting sleep is all he can think about. This client is most likely experiencing which sleep disorder? 1. Circadian rhythm sleep disorder. 2. Breathing-related sleep disorder. 3. Primary insomnia. 4. Primary hypersomnia. Answer. 3. The client with primary insomnia experiences difficulty initiating or maintaining sleep. A key symptom of primary insomnia is the client's intense focus and anxiety about not getting to sleep. The client diagnosed with circadian rhythm sleep disorder reports periods of insomnia at particular times during a 24-hour period and excessive sleepiness at other times. The client experiencing primary hypersomnia typically sleeps 8 to 12 hours per night. They fall asleep easily and sleep through the night but commonly have trouble awakening in the morning. 363. A nurse is preparing a teaching plan for a client diagnosed with primary insomnia. Which teaching topic should be included? 1. Eating unlimited spicy foods and limiting caffeine and alcohol. 2. Exercising 1 hour before bedtime to promote sleep. 3. Importance of sleeping whenever the client tires. 4. Drinking warm milk before bed to induce sleep. Answer. 4. Clients diagnosed with primary insomnia should be taught that drinking warm milk before bedtime can help induce sleep. They should also be taught the importance of limiting spicy foods, alcohol, and caffeine, avoiding exercise within 3 hours before bedtime, establishing a routine bedtime, and avoiding napping. 364. A nurse is caring for a client hospitalized on numerous occasions for complaints of chest pain and fainting spells, which she attributes to her deteriorating heart condition. No relatives or friends report ever actually seeing a fainting spell. After undergoing an extensive cardiac, pulmonary, GI, and neurologic workup, she's told that all test results are completely negative. The client remains persistent in her belief that she has a serious illness. What diagnosis is appropriate for this client? 1. Exhibitionism. 2. Somatoform disorder. 3. Degenerative dementia. 4. Echolalia. Answer. 2. Somatoform disorders are characterized by recurrent and multiple physical symptoms that have no organic or physiologic base. Exhibitionism involves public exposure of genitals. Degenerative dementia is characterized by deterioration of mental capacities. Echolalia is a repetition of words or phrases. 365. A nurse is caring for a client who exhibits signs of somatization. Which statement is most relevant? 1. Clients with somatization are cognitively impaired. 2. Anxiety rarely coexists with somatization. 3. Somatization exists when medical evidence supports the symptoms. 4. Clients with somatization often have lengthy medical records. Answer. 4. Clients with somatization are prone to physician shop and have extensive medical records as a result of their multiple procedures and tests. Clients with somatization aren't usually cognitively impaired. These clients have coexisting anxiety and depression and no medical evidence to support a clear-cut diagnosis. 366. A nurse is caring for a client who reveals symptoms of a sleep disorder. The client also admits that he has broken down and cried for no apparent reason. Which criterion is most important for the nurse to initially consider to gain insight into the client's patterns of sleep and feelings of depression? 1. Stressors in the client's life. 2. The client's weight. 3. Periods of apnea. 4. Sexual activity. Answer: 1. Recognizing that sleep disturbances are often symptoms of stress, depression, and anxiety, the nurse is prudent to discuss these possible factors initially. If the client has a weight problem, suffers from sleep apnea, or reports sexual problems, these also can affect sleep. However, consideration of life stressors occurs first. 367. A nurse is caring for a client who displays gait disturbances, paralysis, pseudo-seizures, and tremors. These symptoms may be manifestations of what psychiatric disorder? 1. Pain disorder. 2. Adjustment disorder. 3. Delirium. 4. Conversion disorder. Answer: 4. Conversion disorders are most frequently associated with psychologically mediated neurologic deficits, such as gait disturbances, paralysis, pseudo-seizures, and tremors. Pain disorders and adjustment disorders aren't generally expressed in terms of neurologic deficits. Delirium is associated with cognitive impairment. 368. A nurse is caring for a client who complains of chronic pain. Given this complaint, why would the nurse simultaneously evaluate both general physical and psychosocial problems? 1. Depression is commonly associated with pain disorders and somatic complaints. 2. Combining evaluations will save time and allow for quicker delivery of healthcare. 3. Most insurance plans won't cover evaluation of both as separate entities. 4. The physician doesn't have the training to evaluate for psychosocial considerations. Answer: 1. Psychosocial factors should be suspected when pain persists beyond the normal tissue healing time and physical causes have been investigated. The other choices may or may not be correct, but certainly aren't credible in all cases. 369. A nurse is caring for a client who is experiencing a panic attack. Which intervention is most appropriate? 1. Tell the client that there's no need to panic. 2. Speak in short, simple sentences. 3. Explain that there's no need to worry. 4. Give the client a detailed explanation of his panic reaction. Answer: 2. The client experiencing a panic attack is unable to focus and his ability to relate to others is diminished. Therefore, short, simple sentences are the most effective means of communication. Telling the client that there's no need to panic or that he's safe, or offering detailed explanations, invalidates the client's feelings of anxiety. 370. A nurse is caring for a client who reports that she feels a choking sensation in her throat, a racing heart, and fearfulness. These symptoms have occurred almost daily for the past 3 months. Suspecting a psychological component, the nurse anticipates administering 1. Benzodiazepines. 2. Proton pump inhibitors. 3. Nitroprusside. 4. Lithium carbonate. Answer: 1. Pharmacologic management would consist of either tricyclic antidepressants or benzodiazepines. Proton pump inhibitors are used for GI disorders. Nitroprusside is a vasodilator used for hypertensive emergencies. Lithium carbonate is an antimanic agent. 371. A client who experiences panic disorder states that he's frequently overwhelmed by feelings of powerlessness. In working with this client, the nurse should initiate which intervention? 1. Assist the client to recognize unnecessary risk-taking. 2. Explore with the client issues related to identity problems. 3. Teach the client problem-solving and decision-making skills. 4. Have the client discuss the things he desires in a relationship. Answer: 3. A client with panic disorder commonly has feelings of powerlessness and helplessness, and can easily feel out of control. Teaching the client problem-solving and decision-making skills can promote the ability to cope and to have a sense of personal control. A client who experiences panic disorder typically doesn't tend to engage in high-risk behaviors or have identity problems. A discussion about relationships is premature for this client.